Hello again. I appreciate everyone taking some time out of a very busy pre-AEP season to spend 40 minutes or so with me as we walk through why Lasso Healthcare and what is a Medicare MSA, because for a lot of people, this is the first time this plan is going to be available in their state. And so it's important to understand why this makes sense for your client and really which client it does make the most sense for. And we'll be talking about that quite a bit. I am a licensed agent. I love this plan. I would buy this plan if I were turning 65. I'm 43, so I've got a few years before I turn that corner. But we'll talk a lot about why I would buy this plan. And by the end of it, you'll have a great understanding about how Medicare MSAs work and what they are, and really how to sell it and who to sell it to. So without further ado, let's go ahead and jump right in and get moving on this. So let's see. There we go. All right. What's an MSA? All right. 101 stuff here. I'm a big believer in you got to know what you're selling before you can sell it. So an MSA stands for Medical Savings Account. Very similar to a health savings account. The only difference is an MSA is available over 65, where an HSA is under 65. For those of you who personally have an HSA or have sold them, you're going to have a nice head start over other people with an MSA because there's so many similarities. I have had an HSA for probably 10 years, maybe longer, maybe 15. I love the high deductible health plan concept coupled with a health savings account. And I personally have my health savings account with the same vendor, which is Optum, actually owned by United Healthcare. So I'm also very familiar with how the Optum bank works, and I'll touch on that as well. So MSAs are just another type of Medicare Advantage plan, really no different from private fee-for-service, a HMO, a PPO. A lot of people are familiar with MSAs because that's the question on AHIP every year that they struggle with, because they've never been able to learn anything about them because they've never been available in their state. Well, that's changed. Exciting, right? So it's actually probably the most simple Medicare Advantage plan there is. Zero premium. It is an MA only plan. Both of those are required by law, zero premium and MA only. And also, if they are in a state, they're in every single county in the whole state. So you're probably sitting there thinking, wait a second, hold on. I've now got this plan that I can offer in rural counties where there may not be any other MA plan. Yes, that's right. Or maybe you're like me sitting here in Texas, and when you look at the map, all you see once you get west of I-35, for those of you not in Texas, basically the western half of the state, all that's available are the Humana and United Healthcare RPPO plans, which have a maximum out of pocket of $6,700. You've got limited networks, limited providers who will take them. You've got a PDP that may or may not work well for the client. And often those come with a premium, maybe around 50 bucks or so. Usually those aren't zero premium when you're in the rural counties. So when you compare that to an MSA, when you've got zero premium, you get to select a PDP that works best for your client. The beautiful thing about an MSA, my favorite thing about MSAs, is the provider choice. It's just like original Medicare in that, excuse me, in that as long as the provider is accepting new clients and you can see them. It's really that simple. It's just like original Medicare. So there's the freedom to see pretty much anybody provider-wise out there. Mayo Clinic, Johns Hopkins, MD Anderson, Sloan Kettering, big hospitals that for the most part don't accept any Medicare Advantage plans. Excuse me, guys. Sorry, I got a little something caught in my throat. So you don't have that issue with Lasso, which is a huge selling point with this plan. So back to the script, pardon me. So we've got two parts. We've got a high deductible health plan, and we've got the MSA, the savings account. And one of the key differences between an MSA and an HSA is with an MSA, the insurance company is the only entity that can put money in the account. With an HSA, I can tell you I put like $575 a month into my HSA account for my family. So with an MSA, you cannot, as an individual, contribute to your MSA. Only the company can contribute funds to that. And as you'll see down here, we've got two options for 2020. And this is a huge change from last year for those of you who offered this plan in the past. The way it worked last year, where the states where it was available, they had 3 different regions. The deposit was the same in every region, but the deductible varied by about $1,000 per region. And it was typically the major metro areas where it had the lowest deductible. And there were states like Mississippi and a few others where the whole state was Area 3. Well, the beautiful thing is for 2020, anybody who has this plan right now is going to be crosswalked. Yes, that's an official term, from their current plan into the growth MSA. That's the one that you see over here on the left side of your screen. And that's the one where it's got a $2,000 deposit and a deductible of only $5,000. So the member responsibility, if you want to think of that in another way, you can think of that as the maximum out of pocket, is only $3,000. Wow, that is amazing. But there'll also be another option. That's the Growth Plus MSA, which has a $3,000 deposit, but a $8,000 deductible, so member responsibility of $5,000. So who should look at either plan? Well, really you should discuss both of them with your clients if they are really healthy and they've not had a lot of health conditions. I mean, obviously everybody's crystal ball is broken. You never know what next year is going to look like. But the Growth MSA is a good option for somebody who's in good health and also that has some resources. They've got some funds set aside that if they do have a bad year, obviously their deposit is not going to cover everything with their deductible. So they need to make sure that they have the $5,000 credit card, savings, whatever, to pay that. Back to HSAs for a second. One of the biggest groups of people that you need to be targeting or thinking about are people turning 65 who have an HSA. Again, thank me, but I'm not 65. So you need to ask the question to every single person you talk to who's turning 65. The additional question is, Ms. Jones, tell me about the health plan that you're coming off of. Have you ever had an HSA, or do you have any funds in an HSA account by chance? Well, if they answer yes, this is absolutely something they should consider. Because one, they're used to the concept of a high deductible health plan with a savings account. And better yet, they can use all the money that they have stashed away over the years in their HSA account with this product. You can't move the MSA funds or HSA funds into the MSA. And again, the individual client cannot contribute to their MSA funds, but they can use the funds that they have stowed away over the years in their HSA, coupled with the funds that are contributed to their MSA account from Lasso. So that's a huge plus for people who have had an HSA. Again, they're familiar with how it works, and they already have money, hopefully, in their HSA account that they can use. That'll definitely help them in the first couple of years as they're starting to really stack funds in their MSA. The deposit was larger last year. You'll see $3,240, but the deductibles were much higher. So we have had huge interest in this plan this year, because now when you sit there and you look at the Growth MSA of a $2,000, $5,000 with a $3,000 member responsibility, I mean, guys, that's less than most of your HMOs out there. Here locally, we're at $3,400 with the most popular United Health AARP Medicare Complete plan. And this plan's member responsibility is less than that. You get to sell that client an additional PDP that's going to work for the drugs they take, not just have to be forced on them. So that pays you an additional commission, and it gets your client one that actually works for their drugs. They don't have the network limitations that you run into with an HMO or a PPO. And you've got, the chance to win. And I haven't mentioned that yet. And one thing I would really try to help get in your head and also your client's head is, no matter what kind of Medicare Advantage plan is, that is a you pay when you use it plan, right? Whether it's an HMO, a PPO, or an MSA, or fee for service, whatever. They have very little, if any, premium, but there's skin in the game. And that's why you've got to make sure your client understands, yes, there's very little premium on MA plans. And again, with this plan, zero, but there is responsibility, cash out of pocket, co-payments, co-insurance that the client's going to have to pay. So really, the risk that someone has with the regular HMO and this isn't that different. I mean, it's structured differently, right? I mean, this is a high deductible health plan. I mean, if they spend one night in the hospital, maybe they're only out $300 on their plan with Aetna or Cigna or United or whoever, whereas they're going to be out, they will hit their maximum, their deductible with just one night in the hospital with an MSA plan. Excuse me. But again, the question is, Mrs. Jones, when was the last time you spent the night in the hospital? And we'll cover where you can get in trouble as far as hitting your deductible with this plan. But I mean, the teaser is basically this: spending the night in the hospital, yes. Cancer, heart attack, and stroke, all three of those, and that's kind of a teaser to that being a really good add-on sale to this plan, a lump sum cancer, heart attack, and stroke plan. But spending the night in the hospital, a big day surgery like a knee or a hip replacement, typipally you have some foresight to know when those are coming. And cancer, those are really the areas that often don't make sense for someone because they will hit their deductible. With cancer, it really depends on when they start their treatment. If they started in December, maybe not, but they'll hit it the next year more than likely. But you've got the chance to win. If somebody doesn't have one of those major issues, this is truly a plan where they can stack some cash and in 3 or 4 years have well into 5 figures in their MSA account. And one of the cool things about Optum is they require that you keep $2,000 in the MSA, but the other, any balance over $2,000, your client can actually invest in about 20 different mutual funds. Somebody asked me on a webinar I did yesterday for the list of all of them. I don't have them memorized. I'm a simple man. I put my funds into the S&P 500 index fund, and it just automatically moves it over there every single month. But so you're benefiting from, increases in the stock market. I was able to dollar cost average during the COVID mess when the stock market went crazy low. But now that it's back where it was, I've had a really good year in my MSA account. Again, this is mind-blowing stuff, guys. This is really exciting. And the best part is the funds roll over from year to year. It's not use it or lose it. So again, unlike your HMO PPO, you really have a chance to win with your healthcare dollars on this. Again, there's some risk, but again, I would tell you there's a lot of risk on an HMO or a PPO. They're just structured differently. But with this one, if the client understands it and they are comfortable with the high deductible, man, they really have a chance to do very well with this plan. And again, see providers that they likely couldn't see with an HMO or a PPO because those people may not take the HMO or PPO and they accept Lasso. All right, we've covered some of this, but I just want to drive a couple of these points home. Obviously, the HMO, you've got a PCP typically that's going to kind of be the gatekeeper and tell you where you can and can't go. You've got referrals typically to specialists. PPO, you're typically paying a little more for those plans, premium-wise, but you do get significantly more flexibility on who you can see. Still limited, though, often to even the out-of-network providers. Not necessarily everybody will accept that plan. But with the PPOs, keep in mind the maximum out of pocket typically doubles if you're going out of network. So, there's significantly more skin in the game if they go out of network. I was talking to some clients earlier this year that had an Aetna plan down in the valley close to Mexico and Texas. And it was a PPO, and they were excited that they could go to MD Anderson because HMOs, you can't go to MD Anderson in Houston. Largely considered the top cancer hospital in the world. But their PPO was a $6,700 max out of pocket. So it was $13,400 was their max out of pocket. Again, they were happy to get into MD Anderson, but again, look at Lasso. You can go to MD Anderson and you still only have the $3,000 member responsibility, again, between the $5,000 deposit and the $2,000 deposit, $5,000 deductible. Wow, and zero premium, whereas PPOs typically have a premium. But again, the biggest difference is the deposit. $2,000 or $3,000, whichever plan your client decides to go with, is what makes this product really pop. Again, you have your client has a chance to win with their healthcare dollars. So really at a high level, you can almost ignore this slide except for two things. Really the opportunity with an MSA, whether it's Lasso or any MSA, is turning 65 and AEP. OEP is a non-starter. You cannot use the OEP period to sell or disenroll from this plan. And the reason for that is the deposit. You know, they're going to get that right around the first of the year, and that is largely the reason why they really ratchet down when people can leave or get into this plan. Obviously, if somebody moves in or out of the area, that is an SEP that works, but there are very few that work outside of AEP, moving or turning 65. If someone is turning 65, they will get a prorated deposit and have a prorated deductible. You can basically just divide by 12 and figure out the math to see what those numbers will be. Where's this thing available? Well, the good news is everywhere but gray for 2021. The beige states are new. We've got some big ones in there as far as MA goes, or just population goes. Obviously, Florida is a huge addition that we're super excited about, but we're also filling in a lot of the states. They're in the heartland of the country, Missouri, Oklahoma. But you know, states like West Virginia, typically not a big MA state because it's so rural. Believe it or not, that's a state where I'm pretty bullish on, because based on previous sales we've seen in Wyoming, in Montana, in areas of Utah outside of Salt Lake City, which gets really rural. Nevada was another really good seller last year for the same reason. Because again, this plan is in every single county in the state. Often states like West Virginia and those others I just mentioned might not even have an MA plan available in every county. So it's one of those, how do you like me now moments, because this plan is in every single county, not to mention the beautiful things about the provider access that I was mentioning, you know, being able to choose your own PDP based on the drugs that you take, all the stuff that I've mentioned now 4 or 5 times. But again, the fact that it's in every county, and especially this year with the fact that the benefits are the same in every single county, really is going to make this thing pop. We're excited about all the states, but definitely some of the rural ones, more than you would probably think. All right, who can join this plan? Hint, hint, not everybody, believe it or not. Obviously, you got to be Medicare eligible. You got to live in the service area, which means in the state. But people who are not eligible is actually a list that's unique. People who are eligible for Medicaid, people who are signed up and receiving benefits through the VA. You know, an easy question is, do you get your prescriptions mailed to you, or you go to doctors at the VA? If they do, they're not eligible. And that's because of the prescription benefits that they get, not only through the VA, but obviously through TRICARE for Life, Campus, or any of the other federal employee, you know, postal service type people. They're not eligible for this plan because of the prescription benefits that they get with their retirement. And frankly, if somebody has TRICARE for Life, I mean, that's the best insurance you cannot buy. So they need to stay there anyway. People eligible for Medicaid are not eligible either, or people receiving hospice benefits. Typically, if they're receiving hospice, that's in a life care, so they're probably not a good candidate for a high deductible plan anyway. But very important to keep in mind, no VA, no Medicare, Medicaid, no TRICARE for Life, and no one receiving hospice. So who are good candidates? And I've touched on some of this, and again, I've been bouncing around a little bit. You hopefully can tell how excited I am about this plan, because I love it. I think this is the best option for a large portion of your clients. And so let's dive in and figure out who that is. Well, people who like the idea of MA, but don't like being restricted to a network of providers. So you're telling me people who like zero premium like to go where they want. Yeah, I think that's probably everybody, right? I mean, MedSup gives them that, but they're paying maybe $75 to maybe $250 a month, depending upon their age and the plan that they choose, to have that with the Medicare supplement. Well, they have some risk, obviously, unlike with MedSup, because MedSup, you pay a premium every month to not pay, or pay very little when you use it. With Medicare Advantage, it's the opposite. I like to use an apples and oranges comparison. You pay when you use it on MA because you don't pay very much every month. So you've got some skin in the game. Well, unlike every other MA plan, the MSA is actually putting money in an account for you to spend on your healthcare dollars. Find me another plan that doesn't. It doesn't exist, guys. I have to put money in my HSA every month. The company does that with MSAs. Wow, that's pretty awesome. So people who've got an HSA plan turning 65, I touched on this earlier, that is serious low-hanging fruit, and that needs to be a question you write down today and add to your presentation every single time you're doing a T65 presentation, because they probably have no idea this plan exists, and they are probably going to be interested in it for all the reasons I've already given you. People who are healthy, we joke about the person, walking out of the gym. Yeah, that's a good client because they are in good shape, likely. They probably don't have a lot of comorbidities. It's funny, that was a term a lot of people outside of the industry didn't know before COVID. Now everybody uses it in their regular conversation. Anyway, I digress. But people who are healthy, people who should have some confidence that they are going to win because they haven't had a lot of major health issues, or they don't have a lot of major health issues. And on that note, in 2019, just at 90% of clients actually never hit their deductible. Only 10% hit their deductible, and that was largely by a hospital stay. And again, I'm talking one night will get you there, guys. Obviously, if they are in there for a week or however long, once they hit their $5,000 deductible, or $8,000, depending upon the plan that they choose, they pay nothing after that. I mean, that's their risk with this plan. But because of how expensive it is to spend the night in the hospital, that'll get you there. And I haven't touched on this yet, and it's on one of the other slides, but I do want to go ahead and mention it. The way claims work with this plan, it's just like original Medicare. So if you think of somebody who's got original Medicare and a Med Sup, they go see a doctor, spend the night in the hospital. That's when you get into the repricing from whatever they're charging at the hospital down to what Medicare is. Often it's cut in half or more. Well, it works the same way with the HSA. So they will have the benefit of the Medicare fee schedule, which is huge. And again, that's why providers are happy to work with this plan that take Medicare, because they're getting paid the exact same thing. So clients in rural areas, clients in the sticks, we've touched on that. That's also low-hanging fruit. States like West Virginia, Wyoming, Montana, Nevada, outside of Vegas and Reno, Salt Lake City, outside of Salt Lake City and Utah, really any rural area, it doesn't matter where it is, this needs to be at the forefront of your mind, because again, it's available, it's zero premium, they don't have the provider headaches you have with a lot of the RPPOs if they're even in those areas. And typically those RPPOs have a premium to them. Uninsurable Med Sup clients. Yeah, you heard that right. Often those are people that have been stuck in those plans for a while, so maybe their premiums have crept up, they've gotten hit with some big rate increases, maybe they're spending $2,000 or $3,000 a person. Well, in addition to everything else that I've just told you about, they stop paying those premiums, they go to a Lasso MSA plan. Obviously, they're not paying those premiums, so you can add that $2,000, $3,000 a year savings per person right onto the deposit that they're getting, the zero premium that they're paying, and they're already having a PDP. They can keep the one they have or buy a new one, whatever. But I mean, wow, the numbers really start to look good if it makes sense for them to drop their Med Sup and go to Lasso. And they don't have to be uninsurable, obviously, to drop their Med Sup, but those are some people that I would definitely be thinking about. People who want to choose their own PDP. I've mentioned that several times. If they're taking some specialty drugs that may not even be on the formulary or are going to be in a tier 4 or 5 with another MA plan, and you can find them a PDP that works better financially for them, covers the drugs they need, that could be the difference maker right there. So I love the fact that they buy their own PDP and it's not one that's just forced on them. And of course that pays you another commission. Believe it or not, people who've got chronic illnesses might be a really good candidate for this. People on Medicare disability. Yes, I did just say that, believe it or not. Maybe they're missing an arm, or they've had some sort of, they're blind, or they have some sort of disability that's, they're able to manage the condition. It doesn't dictate a lot of stays in the hospital, which, as I've touched on, is the biggest reason people hit their deductible with Lasso. They may be good clients. Some others to think about. insulin-dependent diabetics or diabetics that have had major changes in their heart or high blood pressure meds. They're not going in the hospital. They don't have any major expenses, but they may not be able to qualify for MedSup because of their diabetic use. People who have lung disorders, COPD, emphysema, if it's managed, it's in good shape. Again, they're not normally going in the hospital for it or other conditions. This could make sense for them, because again, those could be people that either can't get a MedSup or it's just they're already in one, it's crazy expensive, and this is something they should chew on. So again, a whole new group to kind of think about with Lasso. So we've touched on a few of these things, but just kind of wrapping up here and driving some of these things home. Again, only product that gives the client money and where they have a potential to grow that over time by investing the funds above and beyond the $2,000 in whatever mutual funds that they think will do best for them in their situation. Provider choice, I can't beat this drum enough. It's huge. You won't find another Medicare Advantage plan that has the provider access that Lasso has, which is huge. And let's talk about how they can use their MSA funds. I've not touched on this, so I'm glad I got this slide to help me remember. Let's talk about the frying pan inside the frying pan. That's the Medicare A and B expenses that are at the bottom of the circle there in the blue or grayish, blue-gray circle there. This is all your A and B typically covered expenses with original Medicare. That's a given. Of course, all that's going to be covered by the funds in their MSA, or in other words, they can use their funds for their MSA for that. They can also use the funds in their MSA for qualified medical expenses that are not covered by Medicare. Yes, you heard that right. Hearing aids, dental stuff, prescription drugs, glasses, contact lenses. Yes, they can use their MSA funds for all of those things. How exciting is that, right? I tell my clients, look, in the first couple of years, I would try to just use your funds for the Part A and B stuff to make sure that, if you do have to go in the hospital or you have a heart attack or a stroke or big knee surgery or something, you'll have the funds in your MSA to help cover those expenses. But they can absolutely use their funds in the MSA for hearing aids, dentist work, glasses, prescription drugs. That's huge. The stuff they can't use it for is everything else. Well, I say they can't. That's actually not correct. It's a credit card, guys. I have one. And it's a MasterCard or Visa. I forget. So it's accepted everywhere where Visa and MasterCard's accepted. Do not buy TVs with this. What's going to happen is if they're using it for expenses that are not qualified, they're going to get taxed as income and they're going to get a 50% penalty. You want to avoid that. So just make sure they're aware of that. Enrollment works like every other MA plan except for one thing. In addition to enrolling in Lasso, they also have to fill out the paperwork online or paper to enroll in the Optum Bank MSA. That's the only additional step that needs to happen, and it's a critical one because if they're not enrolled, they don't get paid. But it's real simple, and then they're going to get not only their card to use at the doctor's office, but they'll also use the credit card that I was just telling you about from Optum that they can use to access their MSA funds. As far as accessing care, and I touched on this at a high level, but we'll take a little deeper dive here. Obviously, they go to the provider, they show them their Lasso card. And just like with an HSA, again, what I have now, they're not going to pay anything at the provider's office. What's going to happen is the provider is going to send the bill to Lasso. Lasso will reprice it based on Medicare's fee schedule. You will get, the client will get a EOB from Lasso. And again, this works just like my HSA that I have with United Healthcare. And then the client will get a bill from the provider for their, what they owe. And again, it's going to be, they're going to owe 100% of the Medicare fee schedule, that repriced amount, up to their deductible. Once they hit that deductible, Lasso is going to pay everything else. So how do you maximize your value with this? Well, a couple of different ways. Put together a plan to cover the cost in that first year, because again, you're just going to have that deposit unless you're a lucky HSA client holder like me who already has funds in their HSA. You need to make sure that you talk to your client about, okay, look, if you have a bad year, I know you're healthy now, you have a bad year, how are you going to meet your deductible? Well, we'll talk about that in a moment when we set up cancer, heart attack, and stroke, dental, vision, hearing, obviously PDP as 3 cross-sell products that you should be talking to all of your Lasso clients about. But again, I would coach them not to spend their MSA dollars on anything but the A and B expenses in the first year, just so they can stack some funds in that account. And again, you don't have to use your MSA funds. You know, they're clients who will actually pay cash, write a check, put it on a credit card because they love the idea of investing the money in the MSA above the $2,000 into whatever mutual fund they like that's available to them. So, you know, that's an option to consider too. So one of the things that is very different about this MSA, about MSA plans period, than any other Medicare Advantage plans is that it does not cover a welcome to Medicare physical or an annual physical like original Medicare or every other Medicare Advantage plan. Please hear me when I say this. This is different. It's a high deductible health plan, right? So it doesn't cover that. But what Lasso has done is they said, okay, we want your clients to get an annual physical and a welcome to Medicare physical. So what we're going to do is we're going to give them a $100 gift card when they do their annual physical. We're going to give them another $75 when they complete a health survey, and another $75 when they get their labs and get the results back and share those with Lasso. So that's $250. Go figure. That's about the same amount as what those cost when you're looking at the Medicare fee schedule. So really, you're not looking at any money out of your client's pocket when they look at the gift cards that they're going to get to offset their expenses for those items. Cross-selling opportunities. PDP, given. Love the fact that they can choose their own PDP. That is a huge selling point for a lot of clients. Dental, vision, and hearing. Just like with original Medicare, there is no coverage for dental, vision, and hearing with this plan, but unlike all your other plans out there, they'll have money in their MSA that they can use to pay for dental, vision, and hearing expenses if they so choose. How cool is that? Wow, love it. Cancer, heart attack, and stroke. Those are 3 things that you will hit your deductible with more than likely. Heart attack and a stroke typically means you're going to be spending the night in the hospital. And as I mentioned, 1 night in the hospital equals hitting your deductible. It's expensive to spend the night in the hospital, especially when you're paying 100% of the Medicare fee schedule up to your deductible. This is not a plan where it's $300 in the hospital for the first 5 days like many HMOs and some PPOs. Cancer is another one, but I'll say this. Claims work just like every other Medicare Advantage plan I've ever seen. The client is paying 20% of the cost of radiation and chemo up to their maximum out of pocket. With every other MA plan out there, you're not aware of that. I hope that you heard that. I'll say it again. With every MA plan out there other than Lasso, the client's paying 20% of the cost of radiation and chemo. That's one of the reasons why Medicare Advantage plans are 0 premium and MedSup have a $50 to $150 plus premium. With Lasso, they're paying 100%, right? Again, we're repricing to 100% of the Medicare fee schedule. The client's responsible for 100% of those costs up to their deductible. So cancer, it really just depends on when they get their treatment. Hopefully with cancer, you always want treatment to start January 1st, so you can get all of that knocked out in 1 year and not have it fall over 2 benefit periods. So lump sum hospital indemnity, we put together and built a plan through Standard Life and Casualty, small company out of Utah that's available in about 25 states, that is perfectly designed to be sold with Lasso. Why? Because it pays a lump sum benefit. You spend the night in the hospital, first night, and you can choose what that benefit amount is. And it also has a rider that will cover outpatient surgeries as well. The typical hospital indemnity plans out there with GTL, Aetna, and others, they just really don't fit well with an MSA because you really need the lump sum first night in the hospital or lump sum for a day surgery, because that's what's going to have them hit their deductible. The other plans with those carriers I mentioned are really designed to be tailored to work with an HMO or PPO where they're $300 in the hospital for 5 days, or they've got an ambulance at $250 that they're trying to cover. So reach out to us. Lasso also has a plan that's available. One of our marketers can talk to you about the hospital indemnity plans that do work well with Lasso. Certifications, guys, we're almost done. We got 2 slides left. Certifications, this is the easiest product you will ever certify with. Hopefully by now you've knocked out Lasso. It's an open book test and it's 20 questions. It took me 7 minutes. It truly is that easy. I'm not going to spend any more time talking about certifications. It's the easiest. What's in it for me? Last slide, guys, my favorite slide. I would challenge you that I don't think there's another plan that you as an agent can make more money selling while also, of course, doing what's best for your client based on their needs. This pays the maximum allowed commission from CMS. States like Pennsylvania do pay actually a little bit higher than this $539, but that's the normal commission. If it's a replacement of MA, it's roughly half that, $270. If we've got a PDP, we're looking at probably 81 bucks, 41 if it's a replacement. Cancer, heart attack, and stroke. This is rates with Aetna here. For a $10,000 policy, we're looking at $168 in first year commissions. That's a premium of 306 bucks at 55% year one. Dental, vision, and hearing for $1,000 coverage, we're talking 444 bucks, 40%, 178. That's almost $1,000 per person. We haven't even talked about writing a husband and wife. We're talking 2,000, and that's just in year one. Beautiful thing is all these things pay renewals, and Lasso pays lifetime renewals, like most of your MA plans at this point. So you can really build a package that is going to work well for your client, take some of the risk off the table by selling the dental, vision, and hearing and the cancer, heart attack, and stroke. The PDP is pretty much a given, but there's some real dollars that you can make selling this plan to the client that it makes sense for. So if you have questions, I'm not going to cover any questions today because we've got a whole team here that is standing by and that is ready to answer your questions. Call us, 800-299-5567. You see the number on your screen, or you've got our email address. You're welcome to email us with whatever your questions are. But thank you so much for your time. I want to be respectful of it and go ahead and shut things down. But I really appreciate your time, and I hope everyone has a fantastic AEP. And you agree, like me, that Lasso is a great option for many of your clients. Thank you so much for your time. Have a great selling season.